Hi everybody, this is Amber at LoveFit. I wanted to make a quick video today for the pregnant ladies out there to just show you a couple of exercises that are really good, really safe and suitable in pregnancy, but perhaps you haven't thought about as part of your kind of home training and what can I do between classes, or if maybe you're not local, you can't get to a class, but what can I do that is safe? Now, you know, what's safe, what's appropriate is a whole other video. I've got lots of resources on that, so check that out on my YouTube channel. But yeah, today I'm going to show you 3 different things that are maybe a little bit different from your kind of standard, let's just squat, let's just do some nice incline press-ups, you know, slightly different things that are going to be super practical in terms of preparing for your life as a mum. Okay, so first exercise is actually just very simply, or not, as the case may be, getting up from the floor to standing without using your hands. Now, maybe you can do this, and that's great because you're going to need to be able to do it. But let's imagine you're down on the floor. Perhaps you've been out at a picnic and you've changed your baby on the floor. Your baby's been lying on their jungle gym or something, and you're going to pick the baby up. Now, if you struggle normally to stand up without holding onto a piece of furniture to get you up, if you've got a baby who can't yet hold their head and you need both hands to hold the baby, it's really important that you're not going to stand up and topple, okay? So just getting used to doing that move with no hands is very important. So if you're unsure about whether you can do this, you can start without actually holding anything, just having your hands across your chest, and you just come to kneeling and just stand up and come back down to kneeling and stand up, okay? And you can also practice this coming all the way down onto both knees, because let's say maybe you've been in this position and then you pick up your baby, and we want to be able to come up nice and safely. And also it's worth practicing doing this with both legs. You know, try different leg. Which leg are you leading up and down with? Just so that you've got that movement. Now, if you feel okay with that, you can use any kind of weight to practice the same move, and just coming up and come back down. So you can do it to half kneeling, you can do it to all the way down to kneeling, but just practice that move, okay? So floor to standing without using your hands to help you get up. That's number 1. Number 2, the good old humble squat. Very important in pregnancy, very important for keeping glutes strong, very important for preparing for birth and for life as a mum afterwards, because you're going to be bending up and down all the time, and knowing how to squat properly, really important. However, you know, I talk a lot about squatting for all the reasons just mentioned, but whoever said that a squat has to be done symmetrically? You know, exercise does not have to be done in beautiful kind of uniform, here I am holding my dumbbells or squatting with my arms out. You know, life as a mum is often very unbalanced in every sense of the word. So I really like asymmetric work. You'll often have seen me doing kind of one-handed suitcase squats, or lunges holding a dumbbell or a kettlebell, or the Viper, big long tube. But what about if we're using 2 weights? And let's say we put one up by our shoulder and then here, and we're squatting here, making sure we're inhaling down, exhaling up. And we'd practice that on one side, and then obviously we'd switch over and have the same on the other side. Okay, so that's great. Depending on where you are in your pregnancy, how strong you're feeling will depend on what sort of weight you use for this. There's also no reason you can't you know, do overhead squats, but that might be too much for some of you. But yeah, life as mum, there's going to be a lot of, you know, holding the baby and then holding your shopping bags, or maybe holding a toddler and holding their scooter that they've decided to abandon halfway across the park. Not that I'm talking from experience, of course. But yeah, so lots of stuff where you're going to be holding and holding. So really getting used to unbalanced, uneven loads is very, very important. And then finally, the last one I wanted to show you today is just very simply a weighted carry. You know, if you've got any heavy weights at home, kettlebells, dumbbells, anything like that, they're great for literally just holding in one hand, again, asymmetric, and just walking. Literally just walking up and down the room, obviously a lot longer than I'm doing here. I've put the camera at an angle so you can see me getting up and down off the floor, but literally just walking, shoulders down, we're engaging our lats here, and then making sure you switch sides every time you turn round. Because again, you will do a lot of carrying of shopping bags, perhaps maybe you're carrying the car seat back into the house, I wouldn't recommend holding the car seat like this for any length of time, but you know, little journey, I say literally between the car and the house. So just getting used to holding heavy stuff in one hand, going to be really important. Okay, so those 3 things just to mix up your program, but really genuinely proper functional training. So getting up off the floor with no hands, so kneeling to standing. 2, uneven racked suitcase squats, and then one-handed carries of weights. All completely safe for you as long as you're having a normal pregnancy, you're not high risk or any reasons that you should be doing no activity. And as long as obviously, you know, if you've literally never lifted a weight in your life and you're now 38 weeks pregnant, probably not the time to go trudging around with a 20-kilogram kettlebell, but a bit of common sense. And I hope that those are some useful exercises for you. Okay, enjoy.